Are you keeping your baby close at night because it feels natural, but worried they're being unsafe? Or maybe you're exhausted from getting up multiple times every night, wondering if there's another way. Today, we're tackling one of the most controversial topics of baby sleep: co-sleeping and bed sharing. Hi, I'm Jen. I'm a nurse practitioner, IBCLC, and I'm going to give you all the evidence, all of it, so you can make the most informed decision that works for your family, not that works for your neighbor or your mother-in-law. Stay tuned. Before we dive in, I want to be crystal clear about something. This is not a video telling you what you should do. This is about giving you accurate information so you can make decisions that align with your circumstances, your family values, and your comfort level. I'm also going to discuss some safety information that might be difficult to hear, but as a healthcare provider, I have an obligation to share the complete picture. The biggest myth that co-sleeping and bed sharing are the same thing. They're not. And this confusion leads to a lot of unnecessary fear and judgment. Let's get our terminology straight first, because words matter when we're talking about safety. Co-sleeping versus bed sharing. Co-sleeping. The baby sleeps in close proximity to parents, and this includes room sharing. Baby in a crib or bassinet in parents' room. Baby in a bedside sleeper attached to the parent's bed. Baby in a separate bed, but in the same room. Bed sharing, on the other hand, the baby sleeps in the same bed and sleep surface as the parent. It could be the baby in an adult bed with a parent, the baby on the mattress on the floor with the parent, or any shared sleep surface. Room sharing is a specific type of co-sleeping where baby has its own sleep surface in the parent's room. This distinction matters because the research and safety recommendations are completely different for these arrangements. Room sharing is actively recommended by the pediatric organizations, and bed sharing is where the controversy lies. Do you know that globally, around 90% of the world's families practice some form of co-sleeping? In many cultures, separate sleep is considered unusual or even harmful for your baby. Western recommendations are often at odds with global policies and practices. Economic factors play a role. Separate rooms aren't always feasible. And this cultural context doesn't change safety data, but it's important to understand that our Western universal perspective is not the same thing in other countries and cultures. The AAP guidelines are different. They have different recommendations. So let's look at the evidence behind it. In 2022, the AAP recommendations are you room share without bed sharing for at least 6 months, ideally the first year. Baby should sleep on a separate surface designed for infants. No bed sharing under any circumstances, and the use of a bedside sleeper is acceptable if they meet safety standards. The evidence behind these guidelines is that room sharing reduces SIDS by up to 50%. You can see your baby, you can hear your baby. Easier nighttime feedings and monitoring. It promotes breastfeeding success, and you have a faster response as a parent for your infant needs. Why does the AAP oppose bed sharing? It does increase SIDS risk in the bigger studies. The risk of accidental suffocation or entrapment in between bed surfaces or pillows or under parents, difficulty in controlling all the risk factors in adult sleep environments. Population level recommendations must be conservative. So that's where that is. Evidence check, 5 out of 5 stars for room sharing. But when it comes to bed sharing, only 2 out of 5 stars for safety. AAP guidelines are designed for the population level safety. They aim to reduce the risk for the largest number of families out there. Individual risk factors can vary significantly. So what the AAP acknowledges is that some families will choose to do bed sharing regardless of recommendations. The cultural and economic factors that will always influence sleep decisions. And harmful reduction approach may be more effective than absolute prohibition. So there is some wiggle room, and they do realize that some parents are not going to be totally consistent with their guidelines up front. So let's talk about that. So we looked at the AAP for the American Academy of Pediatrics, but what about the global research? If you look at the international research, the UK studies, They show that bed sharing risks vary significantly by circumstance, which is obvious, and that's why AAP has put out some very strict guidelines. Scandinavian research shows that they have a lower SIDS rate despite the higher bed sharing rates in their country. The Japanese data, very low SIDS rates with cultural co-sleeping practices. New Zealand has risk factors that are more important than sleep location alone. So the key insight for global studies, the risk isn't about bed sharing itself, but the circumstances surrounding it. Culturally, many people view separate sleep as emotionally harmful for your baby. Extended family sleeping arrangements are normal globally. Economic necessity in many parts of the world because there aren't extra bedrooms and extra beds to split up between family members. And the breastfeeding success is often linked to your sleep proximity. Professor Helen Ball at Durham University has done a massive study on sleep and cultural sleep changes and how to incorporate safe sleep in different circumstances. She has found that bed sharing practices in multiple countries, as long as it's planned and prepared, has different risk profile than unplanned. So if you're going to bed share, there are some strategies that we want to make sure are happening so that we can make sure it's a safe environment for everyone. First, let's talk about the room sharing evidence. Room sharing is one of the universal practices that everybody, all the pediatric organizations support. Let's look at why. The SIDS reduction is up to 50% lower when compared with babies who are in separate bedrooms. Breastfeeding success rates, much more increased duration and exclusivity with those that are sleeping near mom. Moms sleep faster after night feeds if the baby is in close proximity. And there's a better temperature and regulation of their breathing when newborns are nearby. There's also increased bonding, increased oxytocin and attachment behaviors between parents. Large-scale studies, there were 11,000 families that were researched back in 2017, and they showed room sharing had a very high protective effect. The benefits are seen across different cultures and socioeconomic groups, and it remains significant, even controlling for other factors. If you're going to share a room, make sure that your setup is correct. Baby sleep surface should be within arm's reach of your parent bed. The bassinet or crib or bedside sleeper in your parent's room should have its own separate sleep surface and follow those safe sleep guidelines. Back sleeping, firm mattress, nothing in the crib, etc. Some common concerns with sleeping in the same room: that your baby will wake up more often. Research actually shows that babies may wake slightly more, but parents sleep overall better because they can easily respond to their baby's needs without having to get up out of your bed, out of your room, walk down the hallway to help your baby fall back to sleep. Second concern is that we'll never transition your baby out. You've heard the stories of the 5-year-old who will never get out of their mom's bed. However, most families successfully transition between 6 to 12 months into their own bedroom pretty easily. Next concern is that there's not enough space. Even a small bedside area can work. My own sister put her baby in a dresser drawer, and it was right on the bedside, and it was fine. Proximity is the priority, not a large space. They're little. The room sharing challenges can be a partner sleep disruption. If someone has to go to work in the next morning and they don't want to have to worry about waking up to baby's every move, that can be an issue. There's less privacy for couples, not that your baby cares what's going on next to them. There's space constraints in your bedroom. There's different sleep schedules that you have to align with. But my clinical recommendation would be that room sharing offers significant benefits with minimal risks for most families. Now, what if the option that you would like to choose is bed sharing? I want to be clear, I am not recommending bed sharing, but some families will choose this path regardless of guidelines. If that's your family, here's how to reduce your risks. Essential safety measures: a firm, flat mattress, no water beds, no couches, no recliners. No gaps between your mattress and the wall or the headboard. No heavy bedding. No pillows near your baby. If your baby is in your room, they have to be on their back at the breast level. Parents have to be sober, non-smoking parents only. No other children or pets in the bed. Your room environment should be comfortable temperature. Avoid overheating. No cords or blinds or hazards near the bed. and a stable sleep surface that will not tip or collapse. For parents, breastfeeding mothers show increased awareness of your baby, but that means no alcohol, no drugs, no medications that affect awareness, and not being overtired to the point of a deep sleep. Make sure you're in a healthy weight category. Obesity increases your risk. Baby factors. Make sure you have a healthy, full-term baby only. No illness or breathing issues, and appropriate clothing, not overdressed, because again, there's the overheating risk. The risk factors associated. It is crucial to understand that not all bed sharing situations carry the same risk. Some factors dramatically increase danger, including parental smoking. If you're a parent that smokes, it increases the SIDS risk by 2 to 3 times, even without bed sharing. Alcohol use and drug use. If you are severely impaired, then your awareness of your baby will decline and you will have more risk. Couches are 67 times more dangerous than cribs. If you have a premature baby, their increased vulnerability to all sleep risks. So having the most safe situation as possible is vital. And formula feeding does not have the same protective arousal patterns as a breastfed baby and mom. Moderate risk factors would be parental obesity. It can increase the risk of overlay where you lay on top of your baby. Extreme fatigue. It reduces your awareness of your baby if there's an issue. Multiple people in the bed. It increases the risk of confusion about baby's location, who's where, and little ones don't have the same awareness for what's going on around them as the parent would. Inappropriate bedding would include heavy comforters, multiple pillows, a very soft mattress, everything else that could be dangerous for a baby. Breastfeeding. As an IBCLC, I need to address the strong connection between breastfeeding and sleep sharing. Breastfeeding mothers often end up bed sharing. Night feeding is easier with proximity, less disruption to sleep cycles because your baby's right there. Natural hormonal responses promote closeness and bonding, and cultural practices often link the two with feeding and sleep. The research on breastfeeding and bed sharing include breastfeeding mothers often show different sleep patterns when they're bed sharing with their baby. They have an increased awareness of baby's position and breathing. There's different arousal thresholds compared to formula feeding mothers, and it may provide some protective factors when you're breastfeeding. But something to be aware of is breastfeeding doesn't eliminate all the breastfeeding risks. Room sharing can provide similar breastfeeding benefits, and your individual factors still matter more than your feeding method alone. So if you still have those same risk factors, but you're breastfeeding, it doesn't negate all of those. Consider these alternatives: getting a bedside sleeper or co-sleeper, having a floor bed set up for easy access, using a comfortable chair setup for night feedings where you're up and alert, having a room sharing with quick access to your baby right next to you. I discuss the reality in counseling with my patients that many breastfed babies will end up bed sharing at some point, even temporarily, and especially unplanned. But it's better to provide safety information rather than ignoring this reality of being unsafe. So to support breastfeeding without bed sharing, use your room sharing setup well. Have the baby right next to you, use comfortable feeding positions, address any latch or supply issues that may take feedings longer than they need to, and ensure you get adequate daytime rest so you're able to be alert and awake during your baby's feedings at nighttime. So for those of you who have been bed sharing and now would like to exit the bed sharing phase, here's how to talk about transitioning and that time period that looks a little bit sketchy at first. The best way to go about it is the sidecar approach. Remove one side of the crib and attach to the parent bed. For the floor bed transition, start with a mattress side by side on the floor, so you're still near each other, but you're not sharing the same space. Move to a separate surface in the same room, so you're going from the bed sharing to the room sharing. And start with partial nights. Start with a bedtime routine in their own bed, and then respond to what night wakings as you need to. Consider transitioning before 6 months. It's often easier before they're totally awake and alert of what mom and dad are doing. Between 6 and 12 months, it may require more patience to have that transition happen. And after 12 months, you might need to have some difficulty with nights, but you can involve the toddler in the process. but they're pretty stubborn at that age. The common challenges with transitions is increased night wakings initially. It's going to happen. Be patient. You might have some guilt or anxiety about your baby being abandoned in the other bedroom or in the other bed next to you. And that's okay. That's normal. You might disagree with your partner on timing and the approach that you want to do. Make sure you're on the same page and expect a little bit of a sleep regression during the transition. The best strategies to have success would be to choose a stable time where there's no illness, there's no travel, there's no return to daycare quickly. Maintain all your other routines very consistently. Make sure you're watching for those sleep cues. No one's overtired or over hungry before they're trying to go to sleep. Be prepared for 1 to 2 weeks of adjustment and have a support system in place so you have someone to talk to and someone to hold your hand during some of the hard nights. And then consider your child's temperament in the approach that you take. If transitioning is creating significant family stress or safety concerns, consider a pediatric sleep specialist or healthcare provider to help you walk through it. Here's how to make an informed decision about sleep arrangements for your family. The questions to consider. What are your family's values and cultural background? What does your individual risk profile look like? What arrangement supports your mental health and well-being? What is realistic for you and your living situation? And how does this align with your feeding goals? So let's talk red flags about when to avoid bed sharing at all cost. Any high risk factors present. If you have a premature baby or you have use of substances that can make you more drowsy than you should be. If you're feeling pressured by others, it's not for you. Any unplanned or accidental bed sharing, that's when the dangerous situations come through. Any conflict with your partner about the decision, and if you're unable to create a safe environment. Green lights for room sharing would be it supports your family goals. This is room sharing. It aligns with your current safety recommendations. It's manageable for your living situation. Both parents can be comfortable with the arrangement. And remember, there is no perfect sleep arrangement. Your decision can change as your circumstances change. Safety information should inform but not terrorize you. And individual risk factors matter more than statistics. Professional guidance is available if you need it through your healthcare provider or a sleep consultant or any of the above. The key takeaways would be that room sharing is recommended and beneficial for at least the first 6 months. 2, bed sharing is risky, but risks vary dramatically by circumstances and individual risk factors. Number 3, global practices show sleep arrangements are culturally influenced. It is not one size fits all. Number 4, safety guidelines exist for families who choose bed sharing despite recommendations. Follow those keys to make sure that if you do choose to bed share, it is in a safe way for your baby. Number 5, individual assessment matters more than one size fits all rules. And 6, transitions are possible when families are ready. It's not going to be the same way until they're 5. So one day may look different from the next as long as you're safe. That's okay. Your homework is to honestly assess your family's risk factors and circumstances. What arrangement truly serves your family's needs and safety? If this helped you through figuring out your own sleep arrangements, please subscribe and hit that like button and comment what works for you and your family. And I'll see you in the next one.